we have a number of treatments other than those having to do with lemon juice, and Don Miller is going to show you some of those. Don Miller, it looks as if you have quite a lot of things here, and I think that we're going to do hydrotherapy.
We're going to do hydrotherapy, and the reason why I've got this one right here is Melissa is busy right now with her lemon juice, so I have to use her doll here to demonstrate the particular treatment that I'm going to be showing you. I want to show you what's two different types of packs, we're going to call them. One is what's called a wet sheet pack. Now, Dr. Thrash has showed you the relative size of a virus. It's a very small enemy, but we can attack it in a very large way using something as simple as hydrotherapy. And I believe in hydrotherapy very much. What we want to do when we do a wet sheet pack is basically that's what we use, and I'm going to use for this case just a wet towel, and it's going to be a dry towel. This is what we call a dry run. But we take a towel, in the case of a large human, a sheet, and put it in cold water and wring it out. And then we're going to take the patient, and what we normally have them do, and see this one's frowning because she's not too well today, we'd have them raise their arms, but she doesn't raise her arms very well. But the reason why we want to do that is we take the sheet and we take it.
Perhaps I could help you.
That'd be a good idea. She's not very cooperative today. You want to have every part of the body touching the wet sheet. And so what we do is we take the sheet and we start over and cross it over the body and go underneath the arm and then around this leg over here because it's got to be completely surrounding the leg. Then the other part of the sheet will go across the other way, this time getting this whole arm, this part of the sheet's underneath the arm, this sheet's over the arm. This one came from behind the under the arm and it goes over the arm, and then the bottom of it then tucks around this other leg. Basically, she's completely covered now by a wet sheet. And what we can also do is we can use a hot foot bath to accelerate the treatment or the vigorousness of this treatment. We put her feet in hot water. At the same time, we'd want to take a blanket or a towel and drape her shoulders to keep her from getting chilled. You do not want a person receiving this treatment to become chilled. So I would drape the shoulders, and then I would wrap the entire body in another blanket or a towel, as the case might be. For a child, you can use a large towel. But now the child is being wrapped up. Now what's happening inside here is you first put down this wet, cold sheet. Well, that's going to cause an immediate reaction of a vasoconstriction. But the body is jealous for warmth and for healing, and so it starts sending blood to the area to increase the warmth of the area. Now, as that temperature goes up, which now this is an entire body, the temperature is going up. When the temperature goes up, we are rallying and increasing our white blood cells. We're saying, white blood cells, it's time to get to work. And so now our spleen and our white bones, our white bone marrow starts producing white blood cells, I'm trying to say, and we have far more white blood cells in the bloodstream out there fighting these little viruses to try to bring down the disease process. And this treatment, now the first maybe 10 minutes of the treatment is a stimulant treatment. It'll really get a person riled up because it's cold, but then it becomes, as it starts to heat up about body temperature, a sedative treatment. But as it goes on beyond that, it becomes a pyrotechnic treatment, if I can use the term. It heats the person up and gives the person a fever. And a fever is what we call a friend. It's not an enemy that we have to throw aspirin at. A fever is a friend. And as the person's temperature goes up, as I've already mentioned, white blood cells increase and healing takes place. And before long, instead of having a sickly and sorrowful patient, you have a happy patient because now they're feeling so much better for the treatment. Now there's another thing you can do in this type of a treatment. Rather than using the wet sheet, you can do what's called a blanket pack. And what I'm going to do with this particular treatment is lay my patient down. First, I would prepare the bed, and always prepare the bed before a patient treatment begins. I'd put a blanket down long ways, and a second blanket long ways on the bed. And then I would lay the patient down in bed, and I would cover the patient with these blankets. Now at the same time, you can be adding what we call a fomentation. And you can do a fomentation quite simply at home. Just take a towel, and what I would do is I would put it in fourths, dip it in hot water, wring it out, and then lay it over the first layer of the towel or the blanket that's over the part of the person. And you want to have these things all the way up and down the legs. It sometimes takes for a full-grown adult 12 different towels or fomentations to give this heating effect. And you don't want to put it right against the skin because it should be as hot as you can make it. So you put it against both legs, the abdomen, the chest, and the arms, and then you wrap them up in these blankets. Wrap them up like a mummy. Wrap them up like a papoose. Wrap them up like a dog in a blanket, a pig in a blanket, whatever you want to call them, and you put them there, and this is going to start causing that temperature to rise in the body. Again, white blood cells are increased. They become more voracious. They're a lot faster, and they're much more active. And this is what we need to fight our viruses. You know, many times we go to a pharmacy or something and get some type of antibiotics. Antibiotics do not work against viruses, but God's methods of hydrotherapy do work quite nicely. And so this is a simple treatment. I've used it before on myself and used it on others, and we get some quite nice effects out of these simple treatments, Dr. Thrash.
Yes, and we have patients who have smiley faces and not frowny faces.
That's right.